At the top tonight, we begin with what is sometimes an uncomfortable topic, but one of extreme importance: mental health and suicide prevention.
Tonight, a group of community members came together to dive in and discuss ways everyone, no matter their backgrounds, can make sure they have access to help. Our Bill Churchwell joins us now with details in tonight's top story.
Well, this month is Minority Mental Health Awareness Month, and tonight there was a heavy focus on depression and how it doesn't discriminate. But more importantly, how to break the barriers of that stigma so that someone who needs help can get it.
I'm United States of America's Miss Texas.
When you meet Marissa Ortiz, the first thing you might notice is her crown, or maybe her sash, or just her infectious smile.
I am not seen as someone who suffers from mental illness.
The Corpus Christi native says her anxiety and depression started early.
You had your heart pounding and the sweating, and I didn't really realize what was going on. And it hasn't disappeared. I just learned how to manage it and cope with it better through pageantry.
She's dedicated the last 5 years to volunteering her time in the mental health community through organizations like the local chapter of the National Alliance on Mental Illness.
NAMI is a great resource, and we've said before, NAMI is one of the best kept secrets, but we do not want to be a secret.
Heather Loeb says it's important to discuss mental health, but also making sure folks know there are resources available to help.
A lot of cultures, there's a stigma attached to seeking mental health help, and we want to break that barrier.
That is why the organization hosted this panel of community members, all from different backgrounds, but coming together to share their personal mental health journeys. Judge Ina Klein supervises the county's domestic violence probation caseload.
When I'm working with people who have pretty severe mental health issues, they will tell me, well, you're normal, you will not understand. I'm yet to meet a normal person. I don't think such thing exists.
Addressing one's mental health doesn't always look the same for everyone. Statistics show that only 35% of Hispanic Latino adults seek help for a mental health condition.
For me, going to a therapist that was Hispanic and she understood, I completely understand where you're coming from, but you don't have to keep everything bottled in.
The panel says it's important to really find something that works for you. Do the research and get to know who it is you can turn to for help. Bill Churchwell, 3 News.
Important information there. Bill, thanks for that report.